Liya with Bump and Baby, and we are here today to talk about prenatal exercise, which is one of my favorite topics. And we're joined today by OPTForMama.
Sure. So I'm Amanda. I'm a pelvic floor therapist, and I have a special interest in perinatal care. And I'm Rachel. I'm a pediatric occupational therapist, and I have a special interest with birth to 3 and a passion for parent coaching. And I'm currently pregnant, 17 weeks along. So we are really passionate about supporting mamas, and together we've created OPTForMama, which is a company to support from pregnancy through postpartum. And we currently have 2 courses that help support the physical, mental, social well-being through pregnancy to prepare for birth and to prepare for all the changes that happen postpartum.
Thank you so much. Awesome. We're going to dive right in. So when I did my poll about what things people had questioned about with prenatal exercise, the most common thing people asked about was actually weightlifting. So there's a lot of myths out there that when you're pregnant, you have to stop lifting weights. And I was wondering, is that true, or is it okay to continue doing strength training and lifting weights when you're pregnant?
Yeah, no. So lifting weights is often recommended. It's a great way to prepare your body for the demands you're going to likely face as a mom, as a new mom especially. Babies are heavy, carriers are heavy. Getting babies in and out of the tub or in and out of the crib, that does put a lot more demand on your spine than your spine is typically used to. So oftentimes what I'll have patients practice is just lifting appropriately with doing things like laundry and lifting groceries and stuff while you're pregnant. So your spine and your body is more conditioned to do that when you have to, when you have the baby. I think the things that you want to be careful of or be more mindful of are, the typical lifting mechanics and ergonomics. So just making sure that you're using your legs, you're really widening your base of support. The other thing that happens with pregnancy is you lose that postural stability. So your balance is a little bit more, you're a little more unbalanced. So just making sure you're having a good wide stance can provide you more of that stability. You also want to make sure you're not lifting with weight or whatever you're carrying too far away from your body. You want to keep it nice and close. The other big thing that I see that I don't think we talk about as much is managing your intra-abdominal pressures while you're lifting. So you really want to avoid any of that Valsalva or holding your breath with lifting, because your pelvic floor specifically is already going through a lot with the new baby. Right. So you want to make sure you're giving what I often have patients do is tighten deep core, exhale as you lift, as you lift your lungs or whatever. And just keep conditioning or training your body to do that, so it will do that automatically. But oftentimes it takes that conscious effort and that conscious practice in order to retrain those habits. Anything else? Other precautions would just be, obviously you don't want to wear any lifting belts because you want to avoid that compression over your abdomen. You want to be mindful of any excessive twisting or bending backwards, especially when you have a load to your back. If you're conditioned, if you were a pretty extreme athlete or a yogi before pregnancy, then your body may be able to tolerate some of those movements better. So it really is variable in what your body will be able to handle. But for the general public, I would say just be cautious and be mindful of those types of movements.
Really being attuned not to add something new, like all of a sudden starting a jump rope routine. You don't want these new extreme forces. But that knowing that if you've been working out, this is part of your typical routine, then it's not going to hurt you. And in fact, you want this muscle to be built up now during pregnancy so that when you're lifting your baby in and out of the car, you're already ready for those movements.
So it sounds like weightlifting is actually really healthy and something that women should incorporate, but just taking some precautions to keep their back safe and to avoid too much pressure on the pelvic floor.
Yeah, Rachel can speak to this a little more, but and this is just applies to all exercise in general, but we find that a lot of women feel guilty for not doing all of the things or not doing the exact right exercises. And some people just really don't like to go to the gym and lift weights. They prefer other types of movement, other types of exercise. So I don't necessarily think you have to go to the gym and lift weights in order to prepare for birth and to be a new mom. Absolutely. It's more about trying to integrate. It can be that, but it's also about just trying to integrate these functional movements throughout your day.
So maybe that's taking the stairs rather than the elevator, thinking about where you live. Are you in a city? Can you take a walk to the grocery store rather than the car? And those types of movements are also considered, exercise, and not even the shame and the guilt around having the exact exercise routine that you had pre-pregnancy. We want to try to lift that because there's so many ways to exercise and be healthy during pregnancy that might not look like exercise. But even mindful movements and breath while you're unloading the dishwasher, while you're doing your laundry, those are great times to engage your deep core, breathe, use your legs, all the things.
Yeah, absolutely. Well, so you mentioned the pelvic floor earlier. So when somebody is lifting weights, there can be a tendency to bear down and push down, and then pelvic organ prolapse is very common postpartum. Do you recommend people to do anything specific to try to prevent that? Because Kegels are kind of controversial, but who should do them? Who shouldn't do them? How should women kind of take care of their pelvic floor while they're exercising during pregnancy?
That's a great question. So that question comes with a loaded answer. I think it really depends on your specific pelvic floor. I would say more often than not, women with pregnancy get a tight pelvic floor, or the muscles of their pelvic floor become more tonic, and that can worsen with doing repetitive Kegels or tightening of those muscles that are already stuck in this position. So it is really beneficial to learn how to relax the pelvic floor, especially before birth, because that's what you're going to have to do to push out the baby. You don't need a bunch of strength to push it out. You actually need those pelvic floor muscles to lengthen and open and relax in order to push the baby out. So I think what can be really valuable is going to see a pelvic floor physical therapist. They'll evaluate you. They'll let you know, hey, this is where you're at. This is what you should do. This is how to do these appropriately. Because I do think Kegels we used to just prescribe them for everyone, and we found that that's not helpful. So now they're almost getting a bad rap, but they can be very beneficial, and some women do truly need to work on them. So it's really about learning where your general tone is, and then really learning how to isolate the contraction of the pelvic floor correctly. Because more often than not, I'll have patients come in and they think they're doing Kegels and they're just not doing them effectively. So it's either worsening their symptoms or it's just really not doing much for them. So
twofold, like doing the Kegel correctly, but then also should you be doing a Kegel for your body, or should you first be working on that relaxation piece?
Right. But there are studies have been showing that if you are doing a supervised pelvic floor muscle contraction correctly, it can reduce the risk of urinary incontinence during pregnancy into postpartum, and it can also shorten that last half of labor. So there are a lot of benefits to doing it if you're doing it correctly.
It seems to me like pelvic floor awareness and being able to know if you're contracted or if you're lengthening, and when it's appropriate, during active labor to lengthen, and then when you're lifting weights to actually contract it. It seems like that awareness and being able to choose when it's contracted versus lengthening is actually more the key.
Yes, absolutely. And just learning where you generally stay. A lot of us hold a lot of tension down there and we don't even realize it. Just like we hold tension in our neck and shoulders, we hold it down there too, typically. So yeah, awareness is huge.
Yeah, I had a lot of help from seeing a pelvic floor PT after birth. Probably would have been helpful even before then.
Right. But great, and I'm glad you got in after. I think personally it should be standard care for women to go in before and after, and we're just not there yet. So yeah, that's great.
What do you guys think about running during pregnancy? A lot of women who are used to running long distances will get pregnant, start trying to run, and feel like their exercise capacity is just way less than before they got pregnant. There's alterations in the way that we breathe that might cause people to feel more short of breath, even if their oxygen level is fine. You know, how do you counsel people who are runners or anyone who does a lot of cardio?
Yeah, that's a good question. That's also something I think we've changed our mindset on over the years. We're becoming a lot more lenient on any types of exercise or movement you can do during pregnancy. That being said, I do think you should be listening to your body and watching for signs that your body isn't loving the running. So that could be shortness of breath because, you know, all of the changes with your diaphragm and increased respiratory rate, that does affect, you know, your ability to maintain a healthy breath habit, but also signs in your pelvic floor could also indicate you're pushing your body too much, like pressure in your pelvis, pain in your pelvis, or even in your low back or your hips, or your abdomen, any leakage when you're running. Those would all be signs that you're demanding too much of your pelvic floor, and you should go seek treatment first before you just power on and continue. If you're feeling great during running and, you know, you ran for years prior and it's just like your mental escape and what, you know, I think go for it. It's likely safe, but it's typically at a certain point you get to this point where, you're experiencing all of these changes. Rachel can talk about this too. So running just doesn't feel as good. So you may just start walking instead or doing like a slow jog. So just learning how to adapt.
Being mindful to be in tune with your body. I think one of the easiest things we do when we're in that workout mindset is like, I'm just going to push through and finish this workout. But during pregnancy, and I mean, always, we should be really listening to our body. And when we're in tune and we feel, okay, there's some different types of pressures there, and we take a step back, our workout might change, and a light jog might be what your body needs, and being okay with that and knowing that that's okay for your workout to change during this time. I think one of the golden rules is the talk test. And, you know, can you still hold a conversation during your workout? Then go for it.
Other things to be mindful of, like, you obviously don't want to overheat or get dehydrated, and that is more likely to happen with pregnancy. So if you can exercise in a temperature-controlled room, great. Otherwise, just, you know, be aware of that. Make sure you're drinking lots of water. If you're getting like really lightheaded or really extremely fatigued, or you have a raise in blood pressure, those would be signs to stop. You're just putting too much demand on the body. I think the other misconception, we used to think you can't raise your heart rate above 140 beats per minute, and we've dispelled that. So there's really not a heart rate limit. It's just more based on those symptoms.
Okay. Just one like little nerd thing that I've been curious about is like when in med school, they taught us about how progesterone increases like how big of a breath you take, the tidal volume. So people can feel like they're short of breath constantly when they're pregnant just because they're taking such huge breaths because their body's hormones are kind of prompting them to. If somebody feels short of breath when they start to do cardio and they're really frustrated that they can't do the exercise like they used to, any thoughts on that? Like, should they just like, I don't know, like, is it something that they're going to feel regardless and they can keep going and it's safe? Or is it like, if you feel short of breath, you definitely need to stop or slow down?
I mean, I think it's a spectrum, like depending on how short of breath you feel. If you're really just uncomfortable with it, then that's probably not helpful to just keep pushing through. But if you're aware, like, oh, I just feel more out of shape, or I just feel a little more deconditioned, but I can still continue the run without feeling extremely uncomfortable, then you're probably fine because of those reasons.
The difference in more effortful versus truly out of breath.
Yeah, exactly. It's a fine line. But yeah.
I like how you were talking earlier about that body awareness and really noticing that. I think that comes in really handy then to kind of figure the difference out.
And I think what we've found is as a society where a lot of us are so disconnected from our body just for all the reasons, especially when it comes to exercise. We really have taken exercise as like a way to manipulate our bodies and force us to do these things and to, have all the control around our body. So that inherently disconnects you from your body's cues. So we think that pregnancy can be a really good time to reconnect to that cueing, because we all have it. It's a matter of learning how to listen to it, and that can take practice. But
are there any activities that you would say are generally unsafe? So like a couple of things I'm thinking about are placental abruption. Like if you have any kind of impact, it could cause essentially like a big bruise to form on your uterus and the placenta that would compromise the blood flow to the baby. So that's one thing I was worried about. And then also there have been some studies showing like early in pregnancy, first trimester, women who do anything that's extreme exertion are more likely to have pregnancy loss. So are there any things that people should avoid completely for safety?
I mean, outside of like the things we talked about before, really it's individualized. I think and this is all under the, I should have said this earlier, but this is all under the assumption that you've been cleared to exercise from your doctor, because there are other pre-existing conditions or complications of pregnancy that would limit a lot more of these exercises. But I would say starting a new routine is okay, but if you're going from like doing no exercise at all to trying to do like a bunch of these like HIIT workouts or something that is way more intense, it's probably just not helpful, and it could lead to injury of you or baby, just because you don't have that conditioning. I'm trying to think of anything.
So two things that I get asked a lot are biking and skiing. Like, are those safe to continue?
I mean, I would say, and this is what I tell patients, like with knee injuries too, like it's not necessarily the skiing itself isn't necessarily the bad thing, but it's the risk of falling that you have to take into consideration. So personally, I just have terrible balance as is, and I'm pretty clumsy, so I wouldn't trust myself on skis while I'm pregnant. If you're an avid skier and you feel very confident in your abilities, you know the conditions, you're not in like a crazy area, then it might be okay. But I would probably defer to you on that. Yeah, I haven't seen specific studies to say one thing or the other.
Yeah, I mean, I don't think there are any. I think it's just like the fall risk and how confident people feel. What do you advise people with biking? There's so many people in Portland who are like bike to work and everything, and they're worried about falling off their bike. I mean, it seems like a low likelihood, but I don't know.
Yeah. Personally, I also get nervous biking in Portland, at least, pre-pandemic when there were a lot more cyclists around, just because I don't trust my own ability. But yeah, if you commute to work every day and that's like your thing, you feel very comfortable, then yeah. Again, as long as sometimes that bike seat can put extra pressure on your perineum and your pelvic floor, and that can be uncomfortable and cause pain. But if you're feeling pretty good on it, then I would say go for it.
I think it's also important to weigh the psychosocial benefit. Do you not have a car? Is it going to be more stressful to figure out another way to commute to work? Is biking just something that adds a little extra joy and that is stressing you out when you think about it? Oh my gosh, I'm biking to work every day while I'm pregnant. That extra stress is not worth it then. Right. Go ahead and find another way. But if for you it's more stressful to think of an alternate route, then go ahead and kind of weighing all the risks and benefits, and including the psychosocial.
Yeah, absolutely. So it sounds like you wouldn't say anything's definitely out like skiing or biking, but individualizing it to like how confident the person is, and like maybe even the route, like the bike route or the ski route.
Yeah, exactly. And knowing that, your balance does change with pregnancy. I've had several friends experience this where we're like on a hike and they fall, and typically that probably wouldn't happen, but just because their center of mass is different, like you do just want to be aware of that. And that would be another incentive to work on your balance while you're in pregnancy.
Yeah, I totally know that from personal experience because I had been practicing handstands daily. And then when I got pregnant, the shift in balance was so dramatic, even from day to day, that it was like impossible for me to hold a handstand. Even against a wall, it was like so hard. Just every day was different. And then I just have one last question. With hormone changes like progesterone and relaxin affecting your ligaments and tendons, I've heard a lot of things like you can't really stretch too much or you're going to overstretch things because of how, I guess, flexible your tendons are. What do you think about that?
Yeah, I mean, that is true, and that our joint laxity and hypermobility of the joint gets more flexible or increases with those raising levels of hormones. There's a lot of misconceptions out there about that. So yes, I think it says that it's beneficial to really work on the stability of your joint. So working on those deep core muscles can be really helpful, especially if you're having pain or some dysfunctions with those joints. But I also hear a lot of the time, like your SI joint, the joint where your low back meets your hip, I'll hear people say, oh, my SI joint went out or it's misaligned. And we're finding, like with studies, that's really not true. The joint doesn't go out of place. It really typically doesn't have much movement at all. And it does increase a little bit with pregnancy. So that's where you can develop some like sensitivities around that tissue or just some irritation. But it's not like out of place. So that being said, like you may want to avoid the things that hurt it or sensitize it more, like any deep end range movements of your hips, like a deep lunge, splits, things that are more extreme in the movement or in the range of movement. But in a lot of ways, I think stretching can be helpful to prepare for birth just because you are going to have to get in those maybe uncomfortable positions while you're delivering. And so a lot of the times what I'll have my patients do is practice like a deep squat or practice an elevated lunge, using like a chair or something, just so they're in like holding those positions and maybe even working on their breath while they're holding them. Not to the point of pain, but just kind of finding that edge so their body can get used to those positions for when you're in labor. Or they can determine which positions might feel better for them, so they know, that you're in the heat of it or thick of it, you can, like, oh, that one I don't like, it doesn't feel good, but this one my body typically feels good in. So there's, again, nothing really off limits, but there might be positions that your body doesn't love, and those are the ones you would want to limit.
Thank you. You just mentioned core work. I think that's one last thing too that I want to address is that I think core strength in pregnancy is actually really important, but there's a lot of misconceptions about how to do that core work. So I know lying on your back for prolonged periods is not recommended. Compressing your abdomen is not recommended. So what kind of exercises are safe to do for your core, even through the third trimester?
Yeah, that's a good question too. I think that it will change as your pregnancy progresses, which positions you can tolerate, which ones just don't feel good or you just physically can't get into. But you want to avoid lying on your back for long periods. And then other than that, it's really based on your ability to recruit your deep core muscles, which I think a lot of women just aren't aware of. But that's where it would be really helpful to work with a pelvic floor physical therapist. They can show you how to turn those muscles on and then how to keep them engaged with like functional movements or with your core exercises. Those are like the transverse abdominis, the multifidus in the back, your pelvic floor from the bottom, and then your diaphragm would be like the main four. But the other misconception I often see is like, oh, don't do crunches, don't do planks because you're going to worsen your diastasis recti, which is just that separation of those abdominal muscles, which happens to everyone once they hit the end of their pregnancy. Typically goes away within a few months after you have the baby, but it can persist. And so that's why those theories started was, we want to avoid that gap or that widening of the muscles and crunches have been known to do that. But we're finding now that that's not necessarily true. And if anything, research is showing that hypertrophy of the rectus abdominis, or that six-pack muscle, can be beneficial for lessening the risk of diastasis later on. So when you're doing your core exercises, I would just watch out for any like bulging of your abdomen or coning. So you're seeing a very obvious protrusion of that in between part of your muscle.
Yeah.
And otherwise, it's really based on your ability to recruit those deep floor muscles, and that's where I would seek help if you're not sure what that looks like.
But that myth that core is just not, don't work on your core, like, that's definitely a myth.
Right.
That you can work on your core in different positions besides just being on your back.
Yeah. Like a sideline position is great. You can get on your hands and knees and do some work that way. You work on your core sitting and standing too. You just don't necessarily think of it in that way.
Rachel, since you're pregnant, what are a couple of your favorite core exercises to do?
That's a great question. So we actually have specific exercises laid out in our course, and I follow our course exercises. So I think,
what's your favorite?
I don't know.
Belly breathing.
Yeah. So there's one that's belly breathing, and it's just really conscious movement of the stomach. And I honestly will do this oftentimes on my commute to and from work. So it's not even at a time when I'm exercising.
Right.
Getting it in time that's convenient has become a habit for me. So that conscious belly breathing. Yeah.
It doesn't sound like you're exercising your core when you're just breathing, but that's like one of my go-to recommendations for building that foundational core strength. So
I'm glad that you guys have detailed videos on that, because I find that that's actually, it takes a long time to explain it to somebody in a way that actually makes sense. So it's great that you have that video that people can just go back to and watch whenever they want, because it's on demand, right? To really learn that technique.
And the cueing to really think, okay, is that contracting? And Amanda's really good at giving really nice visual cues that helps trigger the muscles.
Yeah, that's excellent. Do we have any questions from the audience? If you're on the Zoom call with us, or if you're on IG Live, you want to type in any kind of comment. Okay. All right. I don't think we have any questions. So thank you so much for coming on. You can find Amanda and Rachel at OPTForMama on Instagram, as well as their website, OPTForMama.com, right?
Yes. Got it.
Thank you so much, Dr. Lang, for inviting us on to your podcast.
Thank you for being here. I learned a ton. I really appreciate you too.